Okay. Hi, welcome to Real People. I'm Stephanie Allensworth. Today we have a guest back that was just very recent. Welcome, Bette Jo Arnett, here to talk about homeopathic dentistry today. Welcome back. So soon.
Thank you. It's wonderful to be back.
Yeah, we didn't have enough time to talk about all the dentistry, so we're going to do it now.
Right. And so, I had the good fortune to work for a dentist who actually was transforming his practice from being a conventional practice into a holistic practice. And he is actually the man that got me involved in homeopathy, and that's why I went to homeopathy school as well. And holistic dentistry is based on Chinese medicine. So when we are working on a tooth, the holistic dentist understands we're actually working on a channel of energy. So what we are doing to that tooth the day that you're in the office, the filling material that we're putting in that tooth can all have implications on everything that's on the channel. And your viewers can go online and actually, if they Google the dental meridian chart, they will come up with a chart and it will show them. That's right there.
Hold it right up for
and
you.
it's very hard for them to see. But
yeah, but we'll have it. We'll put a link to it on the page.
Right, and so they're very aware that everything that they do can have effects throughout the body. Now, conventional dentistry has recognized that infection in the mouth can be an implication for things in the heart and stuff like that. But this is actually different than that. This is about energy that runs through the different meridians and through the teeth. And all of the teeth have different organs and so forth associated with them. So let's say, for example, I brought a model to make it a little bit easier. If we're talking about this tooth up here, which is the first molar, that one is going to have implications on the thyroid and the pituitary, the stomach, whereas the first molar down here is about the large intestine. And I'm going to talk to you today about how we see that and how we counsel people and give them options on what to do when we're talking about either doing silver fillings or root canals and that kind of stuff. So there's about 4 areas that the holistic dentist is aware of that can be problems for the overall general health. One is one that most of you, everybody knows about, is the silver fillings.
Right.
And the silver fillings are several different metals, including mercury. Silver fillings have half mercury in them.
Okay.
They're 50% mercury.
Which is why we are on a mission to take them out.
Right.
Replace them.
Unfortunately, I've been in dentistry, or I was licensed for a very long time, and they still are teaching putting amalgams in people's teeth. It's the silver fillings are called amalgam. And I talked to dental students even as of last summer from the University of Minnesota. Not only is that one of their prerequisites to do, they're not doing it on a typodont, they're actually doing it in people's mouths. And it is a very easy substance to use. It actually came to this country back in the early 1800s from France, and the doctors that brought it here were considered quacks.
Of course.
And there was another dental association at that time, and then because it's such an easy material to work with and you don't have to have a dry field, they wanted to adopt it. So there were less than 30 men that formed the American Dental Association.
Really?
So I don't have a lot of hopes that we're going to get rid of mercury, but well, I can tell you that there's some things that we can do to, people say, well, I have silver fillings, I'm going to go have them removed, okay? If you go to a holistic dentist, they actually have a tool to measure the electrical current that comes off the silver, actually all metals in your mouth, and they can tell if there's galvanization. So if the mercury is actually being released in your mouth because
Like
there's
outgassing kind of a
outgassing,
thing?
yes, yeah. When you have 2 or more metals in the presence of a liquid, basically you have a battery.
Oh,
And
boy.
but if the electrical measurement that comes off of there is very low, they will recommend that you don't take it out because you release a lot of mercury when you have those fillings removed.
Yeah, I know.
Okay.
I actually had one removed, and I asked the tech there to make sure nothing went down my throat.
Right.
And she asked me why.
I know.
I'm like, really?
Yeah, in the holistic dentist, they're going to put a rubber dam around your tooth, which will protect your throat and from the mercury getting throughout the mouth and everything. The second place that we look to for issues are root canals. And that's when you have an abscessed tooth, you usually end up with a lot of pain, the tooth is dead, and the doctor in conventional dentistry, they're going to send you to the endodontist, and they're going to take out the interior portion of the tooth and put a filling material in it. Basically, that is embalming the tooth.
Yeah.
Now, there's no part of the human body that we embalm other than your teeth. And it's impossible to completely sterilize those teeth. So there can be colonies of bacteria that will continue to live and grow and affect that entire channel of energy, whichever tooth that is, okay? The third place is for bridges that cross the upper jaw in the palate. Your palate is made up, actually you can't see it on this model, but there's 2 bones that come together. And those bones are supposed to be able to move back and forth.
Oh,
okay. When we put a bridge from this side of the mouth over to the other side of the mouth, it restricts the movement of the palate.
Locking it up.
It locks the palate. Now, you have over 20 bones in your skull, and those bones are supposed to be able to move with the body. And the palate, locking the palate can cause everything from headaches to a lot of other things, okay?
Oh, boy.
And then the last thing that the holistic dentist is concerned about is cavitations. And these are areas where you have an extracted tooth, okay? And the extraction site it's healed on the top, but there's a pocket of infection within the bone. Okay, so then even though the tooth is gone, that energy channel can still be affected with the cavitation.
You're making my teeth hurt.
I know. I know. When I talk to people, they say, Bette Jo, you're scaring me. You know, and so
I'm like sitting there going, oh no, I didn't have a toothache until now.
Right. But the point is that I want to share with you today and with your viewers is that when you go to the dentist and they tell you that you need to have the root canal pulled, even the holistic dentist, they're going to refer you to the endodontist and let you make the choice, but their preference would be that you pull that tooth with a root canal and have an implant done there. Dentistry is very expensive. And so I can give you an example because what I do is I talk to people about options, okay? So yesterday I had a lady, she's in her mid-60s. She has one of her front teeth has a root canal in it.
Oy.
And the root canal has re-abscessed around the tip of the root, okay? So then that kind of a tooth, and she went to a holistic dentist. She's referring her to have an extraction. Then she had another tooth up here in the back that had died a few years ago, and she never had a root canal put in there. Now, the deal with her is that she doesn't have any symptoms.
That's interesting.
Okay, she doesn't have any pain, she doesn't have any discomfort, there's not any mobility with the tooth or whatever. So she's looking at about a $10,000 bill to have this retreated, okay? So what I do for people is we sit and talk about the options, and we take into consideration everybody's individual situation. In her case, it's important because she doesn't have any pain. So does she really need to go and do this right now? Well, there are things that you can do to detox the dentistry that you have. And so that's what we talked about with her. And because she has root canals, and we know that there is probably pockets of infection that are affecting her, although she also does homeopathy. She sees a homeopath and is on a constitutional homeopathic remedy, which is an excellent form of detoxification.
Oh, that's good.
For the whole system,
Yeah.
okay? So she's doing homeopathy, and then in the case of root canals and even in cavitations where we suspect there might be infection in the bone, then we recommend that people, when I was at Dr. King's office, we would recommend they do digestive enzymes. Now, the enzymes are not to help you digest the food. You take them afterwards. Well, you take them actually after you've eaten 2 hours, and it's to digest the proteins that the pathology, either from the root canal or from the cavitation, that is circulating throughout your system. And that will help to the body to be able to move the way it's supposed to move. And then in addition, we usually recommend that they do aloe vera and drink it.
Oh.
And you can buy liquid aloe vera. And those 2 things, along with a constitutional homeopathic remedy, will help maintain balance within the body without doing all of the having the teeth pulled.
Right.
Now, if she had told me she was in pain, that's a different story.
Yeah.
You know.
Yeah, so she's not in pain because she's doing these alternative remedies?
It's possible. It's possible. Now,
But the idea is that if you do these alternative remedies, then it's going to help.
It will help the body adjust. It's like what we would.
Would it actually get rid of the infection, though?
It might.
Okay.
And then we have something new. It's relatively new, but people are finding it online, and that's the LED red light therapy and the blue light therapy. And I brought along an example to show your viewers because these are becoming they're very easy to acquire. This one, it has 32 LED lights in it, whereas some of the ones you find online don't have as many.
I love LED.
It plugs right into your phone. Well, I think this is the future of medicine, is light and sound. I think is what is going to heal people. So I sit at night and I play Scrabble on my phone, and I use my mouth guard. Now, this one happens to be a red LED, and this is for regeneration. And what I have found, as we get older, our teeth become more porous because we're actually losing the vitality in our teeth, which is a natural part of the aging process. And this helps to regenerate. And what I have noticed on my own personal teeth is that they look shinier. They are looking a little bit whiter. And the question is if I had cavities, would it help to stop the decay?
I think it would, because I'm a big fan of red light therapy.
Yeah. And I do think that, in dentistry, we called it arresting decay, stopping decay by properly brushing your teeth, by using your dental floss, by using maybe a mouthwash that has eucalyptus in it or something like that.
But not alcohol, though, right?
But no alcohol.
No alcohol in your mouthwash, people.
Right.
People don't realize what it's doing. It's killing all the good stuff, too.
Yes, it is. So there's the red light therapy. Then there's also another guard that has blue light in it.
I have one.
Okay. And the blue light is actually to kill bacteria.
Okay.
Yeah.
But it's making my teeth whiter, too.
Yes, and it does make your teeth whiter. So these are the things that people can,
Be proactive.
they can be proactive to help do detoxification. I've worked on people of all colors, of all cultures, and of all socioeconomic groups. And I can tell you they all have one thing in common. They don't like to go to the dentist. And I don't blame them, because I don't either. And it's so costly to go to the dentist. Now, for people that haven't been to the dentist for a long time, and they're concerned about the cost, because sometimes just the exam alone is over $100.
Yeah.
I encourage people to go to a school of dental hygiene,
Oh.
and we have several here in Minnesota. Normandale, the university, I think Century College.
Right.
There's one, I believe, up in Duluth, St. Cloud. And if you go to the dental hygiene school, you'll get your teeth cleaned, you'll get x-rays, and you will get an exam by a dentist to make sure the student is doing the proper job, you know.
Right.
And then you kind of know where you're at.
Well, that's cool. That's good.
Yeah.
That is good to know. I have a question about people, like for instance, I have a brother and brother-in-law that both lost all their teeth due to chemotherapy.
Okay.
And, you know, the chemo just destroyed the teeth. And they went for years with these just horrible teeth falling out, always infected, and creating health problems for them as
Right.
well, without even realizing how important it is. Right here, good
Yeah.
health begins with your teeth.
Yeah, period. Yeah.
And they say it's the gut, but what goes in, where does it go first, right?
Right.
It
And
has to go through your
so-
mouth.
So what I would say to, let's say for example, if the lady I talked to yesterday said that she had breast cancer, okay, then we would look at the teeth that, now her particular root canal was in the front teeth.
Right.
And in Chinese medicine, this is bladder kidney,
Okay.
the anterior teeth. So let's say for example, Parkinson's has to do with the meridians that go through the wisdom teeth.
Oh, really?
And so let's say you get a diagnosis with Parkinson's, then I would look at, do you have your wisdom teeth? And if not, when they were pulled, then it's possible there are cavitations there. And that may be accelerating or exacerbating the Parkinson's.
Oh, wow.
And so, okay, so then what do? Well, in that situation where you actually have symptoms, there are surgeons that will go in and they will open up those extraction sites and clean it out and then help the bone to regenerate. Sometimes they put in cadaver bone to help reform the bone in
sure.
those areas. And there's a couple of dentists here in town that will do that kind of work. There's probably only a handful of really, truly holistic dentists in Minnesota,
Yeah.
and actually even throughout the country.
So how do they see that? Is it via X-ray? Can they see the
They can see it
cavitations?
in X-ray, and then there's another film called a cone beam, which is more definitive and
okay.
can show actually where the margins are and everything on
Okay,
that.
okay.
And so, and then some dentists will either start by doing ozone therapy, which is another thing that helps to destroy bacteria. That might be what they would choose to do, or even in the case where you have gum disease, you know, they may do ozone therapy for you. I have a little ozonator that I make ozone water in my house, and that's what I drink, you know. And I just do a lot of things that help to keep my body balanced. And so when there is a diagnosis, whether we're talking about Parkinson's or cancer, whatever it is, I always look to the mouth. So when you come to me for homeopathy and you tell me you've just been diagnosed with breast cancer or some other form of cancer, I'm going to look at your dentistry, and then we will discuss whether or not we want to do retreatment.
All right, I might have to come to you.
Yeah. So, you know, it's, I can tell you over the years when I was at Dr. King's office and my experience as a homeopath, people that do have like root canal therapy, there I can tell you I have had people say, well, you know, I was just diagnosed with breast cancer, and within the last year they had a root canal done.
Oh, interesting.
So
which tooth would be breast?
Well,
I asked for a reason.
that one, okay. So if we look at the chart, and I know this is very small,
Yeah, but we'll put
let's
it up
go
on this.
to-
We'll put it on the screen or on a link.
And you asked me the question that I'm more associated with some of the other things, with the sinuses, and let's see, we've got the endocrine glands.
I asked because I had 2 breast cancer surgeries.
Oh,
just
did you?
Lumpectomies in the
Yeah.
same area.
Well,
So
and
that
then
would indicate that maybe one particular tooth, it's on the right side. So.
what would be interesting to look at is your, when people contact me for a consult, I usually ask them to get their x-rays that they have and any dental charting, so I know the level of the bone and everything. And I do want to say that I am not a dentist, okay?
Yeah.
But I was a hygienist for many years, and I taught dental hygiene in 4 different colleges and universities. So I taught dental anatomy and I taught radiology. So I do have that experience that I can draw on. Plus I worked with Dr. King for many years, and you know, just by listening to him.
You know, just to understand a little bit more,
Right.
so you can get some direction and go to the right place. So I don't know.
So if we looked at your dental chart and looked at the area where you do have work done, whether it be crowns, bridges, or root canals, or whatever.
All of the above.
And okay, and then we look at the chart and we say if you have any complaints, whether it be sinus infection or you know, joint pain or whatever, we try and see if there's if there's something that is coordinated with the dentistry. It's not always the case.
Yeah.
You know.
Well, every time I get a sinus infection, which is about the only thing that I'm ever having issues with, it hurts my teeth. My teeth feel like I've got a tooth issue, but I know from history now that it's my sinuses.
And when that happens, I would encourage you to be really consistent with your mouth guard. Okay?
Yeah.
And to the blue light twice a day.
Don't swing back too far.
Okay. The blue light twice a day is a good pattern for that. The red light, actually, you can use it as often as you want to.
Yeah.
I usually only use it once a day.
I have a handheld from the Beamer that I have.
Okay.
So one of those systems that I got through Rockets. So it's got a handheld.
And you know, you can use this. I even use this sometimes. I have, because I hold my phone and I play Scrabble a lot, this particular joint.
Up on your microphone, so hold those up.
Okay. This particular joint is a problem for me as I've gotten older. So sometimes I just sit there and do this.
Good idea.
Yeah.
Good idea. Yeah.
And the red light therapy is amazing.
Yeah.
It really is amazing. And I'm really impressed with it. It's very easy to access. Will your conventional dentist know about it? Maybe.
Yeah.
Maybe not. So one of the things I do share with people when they come to me is if they are not going to a holistic dentist, then we talk about how you address wanting these changes.
Right.
Or asking about these things. Because they are trained in a curriculum that does not include holistic dentistry.
Right.
And it probably is not
Back to the days
to.
of the old taboo, right? You know, we can't do anything natural.
Right, right. So we try and meet every person as an individual, and we talk about the things individually, and then we go from there.
Wow. Yeah. I mean, it's really interesting that, you know, we don't really realize that we have channels connected to our teeth. I mean, the nerves, we've got, I mean, our bodies are like a forest full of nerves and channels and blood vessels and everything. We're connected everywhere, so why wouldn't we be connected in the mouth as well?
So, for example, if somebody comes in and they tell me that this tooth down here is hurting really bad, I want to know what's going on with their stomach because that's the channel, or the intestine. Okay, are you having problems with your, whether it be sluggish, or you have diarrhea, or is there something going on there? And that is part of, you know, what we use as a factor. You know, I did write a book about holistic dentistry, and I was motivated.
I should have brought it back.
That's all right. I was motivated because I had a young woman in my schedule one day. She was in her mid-20s, and she was coming in to have her teeth cleaned before she had her kidney transplant.
Oh, boy.
Okay.
Yikes, is that even a good idea?
Well, they wanted her teeth cleaned. So I'm questioning her, and the story is that when she was 19, she did not have these permanent replacements. Her baby teeth didn't have permanent replacements.
Oh, yeah.
So they made bridges for her when she was 19 years old. The next year, she was diagnosed with lupus, which is pretty unusual for someone that's like 20 years old. Okay. By the time she found her way to Dr. King's office, he sent her right away for dental materials testing, and she was allergic to nickel. And there was nickel in the bridges.
Of course.
And so when you have an allergy, that also can set up a symptom. And then in her case, it went on for so long that it destroyed the kidney. And she had to have a kidney transplant.
Man. Yeah. There's a lot of people allergic to nickel, and I've said it before, I'll say it again, nickel outgasses from the LED lights. So we have to be very careful with that.
We do have to be careful. Yes. And my own husband, I had the experience where he fell and he knocked out all of his front teeth one day. And so I went to Dr. King and I said, well, now what are we going to do? You know, are we going to put a bridge from here to here? And he said, oh, I don't think you want to do that. He said, they're finding that people that have a bridge across the midline end up with chronic headaches. And my husband had headaches for years.
Oh, my.
And once all the teeth were gone, the headaches went away.
Amazing.
So now in his case, we did implants.
Yeah.
And
I mean, how long have implants been around?
they've been around for, I'm guessing maybe even 30 years now.
Oh, really? Okay.
At one time, only titanium was the only substance that was approved by the FDA. Now there's another one, a zirconium, that is approved. So there's a couple of different, but people can have sensitivities to the titanium as well.
Yeah.
So
I mean, it's not normal in our bodies.
Right, and I do think that having dental materials done, if you're going to have retreatment, if you're going to have your fillings removed, we want to make sure that what we're putting back in your mouth is compatible with you.
Right.
And
what's the most inert thing that you can put in your mouth?
Well, at one time I thought it was gold, but that's not true. And I had a lot of gold done when I was a student in dental hygiene because I thought that's going to last forever, you know.
Except for it's the softest metal on earth.
Yes, okay. But anyway, I lost my train of thought.
Oh, yeah. Oh, the metals in the mouth.
The metals in the mouth.
The most inert.
Yeah, and you do want to have, you want to make sure that there's compatibility testing. Now, one of the dentists that is here in the metro area does have someone that does electrodermal screening, and they can test for compatibility.
Okay.
I do that as well, and some of the dentists that are holistic do refer people to me, and I have a little kit that we test against all of the materials they have in the office, including even the topical anesthetic, to see if people are compatible with them.
Oh, that's wonderful. I mean, it's awesome to know that all of this is out here, and you know, I haven't even heard of it. I didn't know it was a thing. So I am so impressed with you. And I'm going to need you back because there is so much more ground to cover. And we are just down to a half a minute now because this goes so fast when it's so amazing to talk about.
Well, it's fun. I love talking about teeth, as you can tell.
I love having teeth.
Right.
And keeping them.
It's the last thing you want to lose.
Yes,
is
exactly.
your teeth.
Other than my mind.
Yeah, well,
It might be late. Too late for that. Well, thank you so much for being here, Bette Jo. And let's do this again and keep talking about all the good stuff, okay?
All right.
So, and
Thank
I'm
you
going to
very
sign
much.
us out. Thanks for keeping it real. Thank you, Bette Jo, and we'll see you next time.
All right. I should leave.